high income and a few middle income countries have already reserved an estimated 8.8 billion doses even before any vaccine candidates are in the market. 3.8 billion doses have been paid for, with the other 5 billion doses currently under negotiation or reserved as optional expansions of existing deals. Canada, for instance, has purchased enough to vaccinate its population 5 times over. Since none of these candidates are approved, some of the purchased vaccine candidates may prove to be unsuccessful. Countries that can afford to are purchasing a portfolio of vaccines in hopes that one or more will get through the regulatory process. Now, Andrea Taylor is one of the authors of this report that we've just talked about, and she joins us live now from London via Skype. So, Andrea, this report paints a very bleak picture for low-income countries in regards to accessing these COVID-19 vaccines. Now, we do know that the World Health Organization issued a fair allocation framework that recommends that doses are first made available fairly and equally to all countries until they're able to protect 3% of their population. So the question is, why is this framework not being followed, and is there a mechanism of enforcing it?
Right. So the COVAX facility is really the only mechanism that we have right now to ensure fair allocation for the first tranche of doses. And many high-income countries have invested generously already in COVAX, which is really important to note. Unfortunately, what our research is making clear is that the direct deals that these countries are negotiating may also at the same time be undermining their investment in equity by reducing the number of doses that will be available in the first year or two.
All right, so this report also, Andrea, says that these inequalities could delay access to COVID-19 protection across large regions, including here in sub-Saharan Africa, until almost the middle of the decade. That's what the report says. So how will this impact the desperate struggle that is on right now to contain this pandemic?
Right. Well, it's really important that we do ensure that all countries can access the vaccine to cover the high priority populations, such as frontline healthcare workers and the elderly, as early and as quickly as possible. Without this, we cannot contain the virus, and existing inequalities will deepen. But our research really underscores the importance of unlocking manufacturing capacity, particularly in Latin America and Africa. And doing this can help alleviate the impact then on low-income countries of the direct deals that have already been made by high-income countries, and it can increase the amount of vaccine that's available in the first year.
So there are also distribution challenges highlighted in this report, such as the need for extreme cold storage, which a lot of low-income countries do not have. Is it all gloom and doom? Can these challenges be overcome, and how?
Right. So the distribution challenges will be significant, and particularly in countries that have large rural or remote populations and countries with poor immunization infrastructure. But there is a lot of good news on this front as well. So we've spoken to a number of countries that are preparing proactively, that are partnering with private sector to ensure cold chain transport and storage. And we're also seeing that UNICEF and the COVAX partners are investing now to ensure that supplies like syringes are in place. So there's quite a lot of movement on this front that is really encouraging. It's really important to remember, though, that not all vaccines will have the same requirements. And this highlights another reason why the COVAX facility is so important, because it can ensure that best fit vaccines are allocated to the right countries. So, for example, if one of the successful vaccines is a one-dose vaccine with refrigeration requirements, that will be a lot easier to distribute in low-income countries and rural and remote areas, whereas a high-income country could administer a two-dose vaccine that needs freezer storage. And COVAX can serve essentially as an air traffic controller to reduce wastage and ensure that the right vaccines get to the right countries.
All right, and we have seen, Andrea, initiatives by the African Union seeking to raise up to $5 billion through the Afrexim Bank towards the vaccine. Can such initiatives forestall what would be a crisis for sub-Saharan Africa countries?
Yeah, so these initiatives are really exciting, and they could really change the situation for low-income countries, as you say. So the partnership you mentioned in particular between the African Union and the Africa CDC is really focused on pooling, procurement, and financing. across African countries, which could really strengthen their leverage and their global position in the market. We're seeing really similar initiatives now developing in Latin America as well. So that's all very encouraging news.
All right, Andrea, thank you very much for that. Andrea Taylor live for us there in London.